Hello friends, I welcome you all to the second day. Well, when your life depends on technology, it happens, and therefore, well, when your life depends on technology, happens. So, so uh, welcome back, and let's hope that the technology holds, and we are able to have a very good session of physiology MCQ discussion. I was suggested that yesterday we had some glitches in between, and therefore I start from the beginning, and therefore let's begin with the session on FMGE. So I hope you all are listening, people are joining in, and it will be a good a session and good creative and high yield session. Those who had joined yesterday and have watched the previous session, yesterday's session, they may have solved these MCQs, but for those who have joined in newly, they can just have a look at these MCQs again. So we will start from the beginning and try to solve these MCQs, first 5 or 6 MCQs which we had done yesterday. Let's look at those MCQs again, and then we will take the things from there. So it will be just a revision for those who attended even yesterday's session. I tell you, when the technology is your your life depends on technology, all these things keep on happening all the time. Well, we have to cope with that. Let's start. All right, first one. So first one MCQ coming up. Are you ready, sitting with the pen and paper or whatever tabs? Here is the first MCQ. A model cell with 3 different transporters X, Y and Z is shown below. Which of the following best describes the transporter Y? Which of the following best describes the transporter Y? So I am waiting for your answers. Some of you have already joined, and therefore I'll check the answers even as you put the answers in the chat box. Okay. So three transporters have been shown, and you can see those transporters. X, what does it show? Sodium is sent out and potassium is brought back into the cell. So what is X? Are you all answering? I am looking at the answers. Come on, come on. Where are the answers? Okay. Okay. So, which of the following best describes the transporter Y? That's the question. Now, X is a sodium potassium pump. Okay, we did this yesterday, but just for the sake of revision, X is the transporter sodium potassium pump, because sodium is sent out and potassium is brought back into the cell. This is sodium potassium pump. It is an ATPase. Okay, it's a primary active transporter. Second one is sodium calcium exchanger. Sodium calcium exchanger. Where do you find sodium calcium exchanger? I'm just waiting for your messages and your answers in the chat box. Anybody? Okay. Anyways, so sodium calcium exchanger is present in the myocardial cell. You can see here that the sodium is brought in and calcium is sent out of the cell. So that's sodium calcium exchanger in the heart. If anyone already aware of this exchanger, then can you tell me what is the mechanism of action of digitalis? I assume that some of the second year, third year students are also listening to this YouTube live session. What is the mechanism of action of digitalis? I'll come to the answer, but just for the sake of further explanation. Digitalis binds to this transporter, which is X, okay, and it inhibits the transporter X, sodium potassium pump. Digitalis binds to this and inhibits this sodium potassium pump. Now this Y, the sodium calcium exchanger, depends on the action of sodium potassium pump. So when digitalis binds to and inhibits this pump, then sodium calcium exchanger also will not work, because sodium calcium exchanger, this transporter Y, it depends on the sodium potassium pump, okay, and that's the mechanism of action of digitalis. It binds to this pump, sodium potassium pump, inhibits the sodium potassium pump, so that sodium calcium exchanger also will not work. Now look at the sodium calcium exchanger. What it was doing? It was throwing the calcium out of the cell, particularly the myocardial cells. Okay, those myocardial cells, from inside of the cell, calcium is thrown out by the sodium calcium exchanger. Now that will also not happen when you give digitalis, and therefore calcium not thrown out means calcium will accumulate inside the myocardial cell, myocardial fiber, and as a result of that, calcium level in the myocardial fiber will increase. Now here I want you to remember one cardinal principle. Strength of contraction of any muscle is proportional to the amount of intracytoplasmic calcium. I hope you all are listening. I hope you all are okay. All right. So the answers have just started coming in, and I was looking for the answers. Yes. So just make a note of this and remember this forever, that the strength of contraction of any muscle is proportional to the amount of intracytoplasmic calcium. So I'll quickly wrap it up. Digitalis binds to X, that is sodium potassium pump, inhibited, because of which Y, the sodium calcium exchanger, cannot work now, which means what? Calcium will stay back inside the cell, myocardial cell. Calcium amount in the myocardial fiber will increase, and apply the principle, strength of contraction of any muscle is proportional to the amount of calcium present in the muscle fiber, in this case myocardial muscle fiber. So this NCX, sodium calcium exchanger, not working, calcium inside the cell, fiber will contract strongly and strongly and strongly. Okay, therefore digitalis is given in heart failure. But that was not the question. What was the question? Which of the following best describes the transporter Y? So now you have to tell me sodium calcium exchanger, that is Y, is what type of transporter? I am looking at your answers. So have a look at the options and then you can tell me the answer. Is it facilitated diffusion? Is it primary active transport? Is it secondary active transport? Or is it simple diffusion? Anybody wanting to answer this? Sodium calcium exchanger. I have said this now 4 or 5 times. Exchangers are what type of transporters? Anyone? Okay. Sodium calcium exchanger is a secondary active transporter, and secondary active transport is of 2 types. You have to recall this. Even if you are a first year student, this must have been already done. If you are a NEET PG student, this is still 5th time revision for you. So sodium secondary active transporter is of 2 types: co-transport, when both of them are going in the same direction; counter transport, when they are going opposite to each other. So have a look at the diagram. They are going opposite to each other. So this is secondary active transporter, subtype counter transporter or antiporter, or also called as exchange. And that is what was the answer to the first MCQ. Now this is done to death, I tell you, this MCQ. Those who are watching for FMGE exam, please make a note of this. Glucose movement and its various transporters are asked in every FMGE exam. Mark my words, even if you are appearing in the next FMGE exam, there is going to be one question on glucose transport. So let's have a look at this question. Glucose absorption from the GIT will need which of the following? Okay. Anybody wants to answer? Glucose absorption from the gut will need which of the following? SGLT2 only, or SGLT2 and GLUT5, SGLT1 and GLUT2, or GLUT5 only? So what's the answer? Glucose absorption from the gut. Now in the initial that glitch, I just there was something that I wanted to mention to you as a senior faculty and somebody with an experience. Whenever you see an MCQ, read the MCQ but don't read the options. This is my sincere suggestion to you, especially those who are in the first year or second year. Okay, don't immediately look at the options and first try to answer by yourself, figure out, then look at the options. This is an important thing for your correct answering of the MCQs, because you know most of the times it may happen that all the options are sounding similar and looking similar and familiar. So please don't look at the options straight away. This is my very humble suggestion to you. Anyways, anyone with this answer? Okay, the answer is SGLT1 and GLUT2. Okay, why is that? So let me have a quick synopsis for the glucose transport. Okay, here is a quick synopsis of glucose transport. Glucose transport in all cells occurs by facilitated diffusion. Facilitated diffusion means glucose will travel from high to low concentration, okay, but no energy required, only carrier is required. So that's the first point. All cells, this is what the case. In the case of GIT and kidney, the case is slightly different. At these two places, glucose transport has 2 transporters, SGLT and GLUT. Means glucose transport utilizes secondary active transport, that is sodium glucose transport, and GLUT, that is facilitated diffusion of glucose, that is GLUT transport. GLUT transporter, that is facilitated diffusion of glucose. So let's have a look at this. All cells, glucose enters by facilitated diffusion using carrier but no energy. by facilitated diffusion. What are the various examples? Let's have a look. Quick synopsis. I know you must have done this. So here we go. GLUT 1. There are various types of GLUTs. Facilitated diffusion of glucose uses these various GLUTs. GLUT 1. Remember the word ubiquitous. Ubiquitous means omnipresent. सब जगह present है body में. Constitutively expressed means by virtue of constitution of that cell, this glucose transporter is present in every cell's membrane. So that's GLUT 1. Okay, present everywhere. RBC membrane, GLUT 1. You name the cell, it has GLUT 1. GLUT 2. GLUT 2 is present in the pancreatic beta cell, which going to secrete insulin. So glucose will enter the pancreatic beta cell by using this GLUT 2, and then in response to that glucose metabolism, insulin will be secreted by pancreatic beta cell. So that's GLUT 2, pancreatic beta cell. GLUT 3, where is it present? Neurons. Neuronal tissue predominantly has GLUT 3. Then GLUT 4. GLUT 4 is insulin dependent glucose transporter. Insulin dependent glucose transporter. तो आपको पता होना चाहिए कि इंसुलिन डिपेंडेंट दो ही टिश्यूज है बॉडी में जिनको ग्लूकोज एंटर करने के लिए इंसुलिन की जरूरत लगती है. विच आर दोज टिश्यूज? ओके, मसल एंड एडिपोज टिश्यू. तो इनमें है GLUT 4. ओके, और GLUT 5 and the GLUT 5 fructose enters the cell by using GLUT 5. Yesterday I did this, so some of you might be just getting this part repeated, that fructose entry into the cells occurs by GLUT 5. Okay, I have not written it here, but just remember there was a very favorite MCQ asked in FMGE exam. Spermatozoal membrane, sperm membrane has which GLUT for glucose entry? And the answer was GLUT 5, because spermatozoa, sperm metabolizes fructose. So fructose enters the sperm by using GLUT 5. So this is glucose entry in almost all cells of the body. Now what happens in the GIT and kidney? What happens in the case of GIT and kidney? In the case of GIT and kidney, glucose has to cross two membranes to enter the blood. Okay, it has to enter the cell which is lining the GIT or kidney. Then it has to leave the cell from other side and enter the blood vessel. So glucose has to cross two membranes simultaneously. And therefore, first from the lumen of the digestive tract or lumen of the renal tubule, glucose enters by using SGLT. So SGLT, sodium glucose transporter. It's a secondary active co-transporter. It will bring sodium and glucose, both of them, into the cell. And then from the other side, glucose will leave by using another transporter. Come on, at least say this. You can write this in your answer. Glucose leaves this cell and enters the blood by using which transport protein, which transporter? Anybody mentioning here? Okay, the answer is GLUT 2. So the answer was GLUT 2. Glucose leaves the cell by using GLUT 2, and therefore digestive tract. The MCQ was on digestive tract. Glucose absorption from the digestive, and this question, by the way, has come in the FMGE exams thrice or 4 times in last 5 years. Different forms. So one more point that I want to highlight here for the sake of your understanding is that topics remain the same, only MCQs get twisted. Okay, MCQ may not remain the same, but the topic is same. So glucose absorption is the topic, and they can ask the MCQ in various different ways. So that is what happens. Like they ask ki a person was vomiting and person got completely dehydrated, and ORS was given to the person, oral rehydration solution. So glucose in that ORS will be absorbed from the digestive tract by using which transporters? We have already answered this question, that in the GIT there is SGLT1 which allows the glucose to enter the lining cell, SGLT1, and then from the other side glucose leaves the cell and enters the blood by using GLUT2. Anyways, this we have already done, so let's not spend much of time on all of this. Answer was SGLT1 and GLUT2. Okay, now this also was done yesterday. Those who did attend yesterday's class may have seen this MCQ. Compared with the intracellular fluid, the extracellular fluid has what? Okay, the extracellular fluid has dash sodium concentration, potassium, chloride and phosphate concentration. The question is, in the ECF, which ion is more and which ion is less? They are asking it about sodium ion, potassium ion, chloride ion and phosphate ion. So let's have a look at the concentrations of different ions and different substances. If this is the cell and this is the ECF, this is the ICF. Now the ECF is rich in sodium. Okay, so major cation in the ECF is sodium, and sodium is low inside the cell. Then potassium, intracellular fluid is rich in potassium, and in the ECF the potassium is low in concentration. Okay, so that is what they are asking in the question. Then second, which is the major anion in the ECF? Major anion in the ECF is chloride. Okay, so chloride is high in the ECF. And which are the major anions in the intracellular fluid? Make a note of this and write it down if you wish to. Major anions in the ICF are proteins, intracellular proteins and intracellular phosphate. So now we can solve the MCQ based on this information. Compared to ICF, the ECF has what? Sodium concentration, potassium, chloride and phosphate concentration. Let's have a look at the answer. Sodium concentration is high in the ECF. Potassium concentration is low in the ECF. Then chloride concentration is high in the ECF and phosphate concentration is low in the ECF. So your answer is high sodium concentration, low potassium concentration, high chloride concentration but low phosphate concentration. High, low, high, low. So yeah, I mean that option will be your answer, option D. I hope you all are listening and trying to answer the question. Anyways, let's go to the next question. We did this yesterday, I know that, so I'm going to quickly wrap these questions and then move on to the CVS, which is today's main target, CVS RS kidney. That will be our main target for today's discussion. Okay, next question. Which of the following is not true about body fluids? Okay, body fluids, which of the following is not true? The total body fluid per unit body weight is more in the infants as compared to the adults. I repeat once again, the total body fluid per unit body weight is more in infants as compared to adults. Is that a correct statement? No, it's not correct. This is false statement and therefore first statement itself is the answer. Not true about the body fluids. Just remember one thing forever. Infants are more prone to dehydration compared to adults. Why is that? Because they relatively have less body fluids per unit body weight. Okay, infants, children more prone to dehydration. आपने सुना होगा कि diarrhea, vomiting and the kid was dehydrated. Why is that? Because they have less body fluid per unit body weight. So that's not correct statement and therefore the answer. ECF volume is 70 kg adult. In 70 kg adult man would be approximately 14 liters. Yes, we did that yesterday, but okay, Nisha is asking, can you explain once again, sir? Which one? Which question actually? Okay, fine. Now she says it's clear. Okay, good. So second option ECF volume. अब ये एक पहाड़ा है जो मैं आपको रिपीट करने के लिए कहने वाला हूं. Okay, so let's have a look at that table of 14, 28, 42. Let's quickly go to that table. All right. Total body water is 60% of the body weight. 60% or 0.6 into body weight. Okay. Next, out of this, 2/3 is ICF, 1/3 is ECF. 2/3 is ICF, 1/3 is ECF. Okay. So 2/3 मतलब कितना हुआ? ICF will be 0.4 into body weight and ECF will be 0.2 into body weight. Okay, तो 0.2, 0.4, 0.6 इस तरीके से you have to remember that total body water 60% of the body weight. Out of that 2/3 मतलब 40% will be intracellular fluid and 1/3 that is 20% will be the ECF. Okay, now that table which I was telling you, a 70 kg healthy adult is our reference man. When we say what is the reference man, it is 70 kg healthy adult. So 60% of 70 kgs, it becomes how much? Come on, 42 liters. So total body water is 42 liters. 2/3 of this is inside the cells, 1/3 is extracellular fluid. So 2/3, 1/3 matlab 28 liters is the ICF and 14 liters is the ECF. Okay, is this clear? Therefore once and for all isko by heart kar lo, this table 14, 28, 42. ECF volume 14 liters, ICF volume 28 liters और दोनों मिला के 42 liters is the total body water. Moving further, talking about the ECF volume. ECF volume is divided into two compartments. Okay, 3/4 is called as interstitial fluid. Extracellular fluid volume की बात चल रही है, तो 3/4 is interstitial fluid and 1/4 is plasma. Remember, ECF, extracellular fluid, interstitial fluid and the plasma. So out of that 14 liter volume of the ECF, 3/4 means roughly 11 liters will be interstitial fluid and roughly 3 liters will be the volume of the plasma. So these are the volumes of various body fluids. Now there is one more MCQ I know after this, so I will be just taking that into account, and I'll talk about the blood volume also. In the body fluids, what is the blood volume? How much is the blood volume? Total blood volume is 8% of the body weight. Blood volume is 8% of the body weight. Okay, so in a 70 kg healthy adult, 8% of the 70 will be the blood volume and roughly therefore it is 5 liters. हमारी बॉडी में 5 liters blood होता है. And then out of this 8% of the body weight is the blood volume in our body. 5% is plasma volume, 3% is cell volume. So 5% is plasma volume and 3% is cells, volume of the cells. Okay, that's the distribution, or that's the divide of the various body fluid compartments. I want you to remember this particular thing. 5% is the plasma volume and 3% of the body weight is the volume of the cells, hematocrit. Okay, cell volume considered put together is called as hematocrit. Okay, remember this because there is one MCQ asked on this one. Okay, let's move on. ECF volume of the 70 kg adult man would be approximately 14 liters. That's right, we did that just now, so no problem. Intracellular fluid is 66% of the total body weight. Well, yes, we did that just now. 2/3 is ICF and 1/3 is ECF. So no problems over there. And synovial fluid is transcellular fluid. Yes. Please note down if you haven't noted it earlier. That is synovial fluid, aqueous humor, vitreous body, or all such fluids, pleural fluid, all these put together constitute 1 liter and it is called as the transcellular fluid. You know this, या ना तो ये सेल के अंदर है और ना ही immediately सेल के बाहर है और इसलिए it is called as a transcellular fluid across the cells. Okay, which one? Synovial fluid, pleural fluid, aqueous humor, etc. All these fluids constitute 1 liter. So transcellular fluid is 1 liter of the blood of the total body fluids. Okay, this is the MCQ that I was referring to. So I am not going to stop here because we want to save time today. Just for your solving of the MCQ, a 60 kg man has hematocrit of 40%. Okay, hematocrit of 40%. His plasma volume would be approximately how much? Now look, there are two ways of solving this. I told you just now, plasma volume is how much? 5% of the body weight. Didn't I tell you just now? 5% of the body weight is the plasma volume. Okay. So 5% of the 60 kgs and your answer will be clear. So that's the answer. Are you solving? Anybody solving? I'm just trying to have a look at the chat box. Anybody solving? Anyways, so 5% of the 60 kgs, that's the plasma volume. Right. So, but what about the answer? What's the answer? 5% of the 60 kgs. Anyways, we want to save time today, so I'm going to move on quickly. जल्दी जल्दी आगे बढ़ेंगे, अगले MCQ की तरफ जाएंगे, आप solve करो. Okay. अब ये MCQ, this is the MCQ जो this has been asked twice or thrice. Therefore, I am going to take some time to elaborate on this MCQ. पेन और पेपर लेके बैठो या टैब लेके बैठो, जो भी आपको मंजूर हो, लेकिन इस MCQ को छोड़ना मत. ओके, कॉन्सेप्चुअल है. 5 gram mannitol was injected intravenously. Mannitol is used to measure what? To measure the ECF volume. Okay, 40% of the mannitol is excreted out. After equilibrium, plasma concentration of mannitol is 30 mg/%. So calculate the ECF volume. Okay, so I will take about 2 minutes to explain this because on this topic the MCQs are being repeatedly asked. Okay, we are talking about indicator dilution method. Indicator dilution method. ठीक है, indicator dilution. अब imagine करो, we have to measure the volume of a particular container. We want to measure the volume of this container, of this fluid in the container. We will select an indicator, this much indicator with known initial volume. Okay, with known initial volume, this indicator is taken and it is put into this. It will get diluted in this fluid, and then we will take up the sample and measure the concentration of this indicator. Okay, that's the method called as indicator dilution method. अब इसमें क्या प्रॉब्लम है नहीं समझने के लिए? The problem is this कि how do we know whether the volume was more or less? So just check it. Check this diagram now. एक और वॉल्यूम है, there is one more volume, and in this one more volume, if we put the same amount of indicator, This is called as I, the initial amount of the indicator. Now we place in this container. Now see, in this container, we want to measure the volume of this container. So dilution of the indicator will be to a much greater extent. आप समझ रहे हो? Same amount यहां डाला and in this volume. तो यहां पे obviously dilution will be to a greater extent because this is a bigger volume, and dilution will be to a greater extent means when you collect the sample, the concentration of that indicator will be less. समझ रहे हो? Dilution is more, that means concentration is less, isn't it? So if you collect the samples from these two, what will you find? You will find that concentration of that indicator is less in this because volume is more. That means concentration and volume are inversely proportional. Remember this much. And now we will come to the MCQ. Okay. The equation that you have to remember now is V is equal to I upon C. V is equal to I upon C. V, the volume of the compartment that you want to measure, like ECF volume we are going to measure. I is initial volume of the indicator that you have used, means I showed you here, this was the initial volume that we used, initial volume of the indicator. ये तो ऐसे एग्जाम्पल के लिए बताया था, अब बॉडी की बात कर रहे हैं, ECF वॉल्यूम की बात कर रहे हैं. आपने एक नोन इनिशियल वॉल्यूम ऑफ इंडिकेटर जो है वो डाल दिया ECF में, प्लाज्मा और इंटरस्टिशियल फ्लूइड, और फिर ये उसका इनिशियल वॉल्यूम, इनिशियल ऑफ द इंडिकेटर दैट वी पुट इन द ECF, and this is the concentration. Once it gets diluted into the compartment, then this will be the concentration, and less the concentration will mean उसका dilution ज्यादा हुआ है, और उसका dilution ज्यादा हुआ है इसका मतलब volume of the compartment is more, इसलिए वो dilute ज्यादा हुआ indicator. That's the method. So all of this I hope you have already read because this is the first chapter. So even first year students must have done this by now, and FMGE preparing students who are watching this, they to already done it 5 times. Okay, so now let's come to the MCQ. 5 grams of mannitol was injected into the ECF. If anybody is trying to solve the MCQ, I am just having to trying to have a look at the chat box. 5 grams of mannitol was injected into the ECF. Okay, mannitol got dispersed into the ECF, but they have said 40% got excreted immediately. Means after you injected the mannitol in the extracellular fluid compartment, 40% got eliminated out of the body. So our formula will have to be modified. V is equal to I upon C. ये था ना, I is initial volume that you injected, यहाँ पे है 5 grams, and C will be concentration of mannitol after it gets dispersed and diluted into the ECF. लेकिन 40% got excreted out of the body. So A amount of indicator, A amount of indicator that leaves the compartment, क्योंकि ये तो चला गया बॉडी से बाहर, this was not diluted by your ECF volume, तो इसे पकड़ने का कोई मतलब ही नहीं, इसे पहले ही न्यूमरेटर से हटा दो इनिशियल वॉल्यूम में से, because this was not useful at all, ये excrete हो गया. So now I want you to repeatedly say in your mind twice or thrice, V is equal to I minus A upon C, V is equal to I minus A upon C. Okay, volume of the compartment being measured is equal to I initial volume of the indicator that you inject into the compartment, A amount of the indicator that leaves the compartment or gets excreted out of the body, and C concentration of the indicator when you collect the sample from the compartment, from the ECF. Okay, let's let's consider the MCQ and then we will move forward quickly because this all was actually done yesterday. Okay, 5 grams of mannitol was injected into the ECF. So this is the initial volume of the indicator injected, I. But 40% got excreted out of the body. 40% of 5 will be 2 grams. Amount of the indicator that left the compartment, that is 2 grams, 40% of 5 grams. And then when you collected the sample, the concentration of mannitol was, how much was it? 30 milligram percent, is it? Okay, 30 milligrams percent was the concentration. So how much is the volume of the ECF? Solve the equation and I'm just looking at anybody solving this MCQ and trying to come to the answer. Anyways, let's just solve it. 5 grams minus 2 grams, how much? 3 grams. So 3 grams in the numerator. And concentration of the mannitol after it got completely diluted in the ECF, the concentration was 30 milligram percent. अब देखो 3 grams upon 30 milligram percent. यहाँ स्टूडेंट्स मार खा जाते हैं, इसलिए इसी तरह ठीक से समझने की कोशिश करो. प्लीज ट्राई टू अंडरस्टैंड दिस के न्यूमरेटर जो है वो 3 grams of mannitol dissolved in the liters of the body fluid. Okay, liters of the body fluid. तो ये per liter है. And denominator is 30 milligrams percent. Milligrams percent means milligram per 100 ml. So this is not matching. तो मिलीग्राम पर 100 ml को पर लीटर में कन्वर्ट करना पड़ेगा. ओके, मिलीग्राम पर 100 ml, मिलीग्राम परसेंट का मतलब. सो द इक्वेशन विल बिकम 3000 मिलीग्राम्स. ये 3 ग्राम्स है ना, मतलब 3000 मिलीग्राम्स into the liters of the body fluids upon 300 milligrams per liter. 30 milligram percent मतलब 30 milligrams पर 100 ml. पर 100 ml को पर लीटर में कन्वर्ट करना हो तो 10 से मल्टीप्लाई करो. 30 into 10 दैट इज 300 मिलीग्राम. हाँ, नाउ दिस इज मैचिंग. पर लीटर हो गया दोनों. अब ये आप सॉल्व कर सकते हो. द आंसर इज 10. सो दैट वाज द आंसर टू द MCQ. लेकिन those who are watching and those who are going to appear for the exam in the coming exam, I want you to at least repeat this formula once for my sake. V is equal to I minus A upon C. V, the volume of the compartment being measured. I, initial volume of the indicator injected into the compartment. A, amount of the indicator that leaves the compartment, excrete हो जाता है body से. And C is denominator, concentration of the indicator after it got diluted completely. All right. So that's the MCQ. एक MCQ और था कल, तो वो भी देख लेते हैं क्विकली और फिर न्यू MCQs will come up now. एक बात है, I have noticed one thing. आप पढ़ लो MCQ, I will also read, but it's a long MCQ. The cardiac muscle has the unique property of contracting and repolarizing faster when the whatever is written. Actually, the question is in the last line. So my suggestion to you would be this, कि whenever you see 4, 5, 6 lines, okay, one after the other in the MCQ, don't get flabbergasted by it कि अरे बाप रे ये तो इतना बहुत एकदम कॉम्प्लिकेटेड सा MCQ है. नहीं, कॉम्प्लिकेटेड नहीं है, ठीक से पढ़ो. Actually there is only one line which is the question. What is that line? Which is the fastest conducting part of the heart. तो अगर आप लोग सुन रहे हो, if you are listening to me and you are answering the questions, I would appreciate that. You are welcome to answer this question. Which is the fastest conducting part in the heart? And you can also write which is the slowest conducting part in the heart. The fastest conducting part in the heart is Purkinje fibers. Okay, Purkinje fibers are the fastest conducting part in the heart. Yesterday I mentioned this, and for the benefit of those who have joined in today, just mentioning it once again. Purkinje fibers are the fastest conducting part in the heart. They are in the ventricles, and the point is because they conduct the impulse very rapidly, all fibers in both ventricles, they are excited almost simultaneously. Okay, which means what? All the fibers of both ventricles will also contract simultaneously, and that will increase the pumping effectiveness of the heart. So that's the benefit of Purkinje fibers. And what is the slowest conducting part in the heart, which is also responsible for heart block conditions? AV node. Yes, so AV node is the slowest conducting part. Purkinje fiber is the fastest conducting part. This also I think we did yesterday, but just quickly go through it, try to answer, and I am looking at the options. Yes, Chinmay has answered Purkinje fibers. So yes, if the Purkinje fibers situated distal to the AV nodal junction, AV junction, become the pacemaker of the heart, what is the expected heart rate? What will be the expected heart rate? Anybody wants to answer this? If the Purkinje fiber becomes the pacemaker, then what will be the heart rate? These are the options to you: 30, 50, 60, 70 beats per minute. Okay, you can type. Till then, I'll just have a look at your answers. What is the, if the Purkinje fiber becomes the pacemaker of the heart, what is the expected heart rate? And these are the options: 30 per minute, 50 per minute, 60 per minute, 70 per minute. So what's your answer? Come on, anybody just wants to answer? 30. Yes, Amit Mishra, you're right, it's 30 per minute. And why is that? Because just note one or two sentences and then we will move on quickly to the newer MCQs. And that is, there are many parts in the heart which have the property of autorhythmicity, self-excitation. This property is shown by many parts in the heart. SA node is the pacemaker, and every impulse is generated in the SA node autorhythmically, because SA node shows this property in a fastest frequency, highest frequency. Kitni? 80 to 100 is the intrinsic rhythmicity of the SA node. हालांकि heart rate 72 beats रहता है because vagus, parasympathetic nerve, slows down the SA node little bit, and therefore normally the heart rate is 72 beats per minute. That's okay. But if SA node fails, AV node takes over. AV node is autorhythmic. What is the natural rhythmicity of the AV node? It is 60 beats per minute. 60. Yes. So if AV node becomes the pacemaker, heart rate will be 60 per minute. And then if AV node also fails or there is heart block, then Purkinje fiber can become the pacemaker. Its natural frequency of excitation is only about 30 to 40 times in a minute, and therefore if the Purkinje fiber becomes the pacemaker, heart rate will be 30 beats per minute in this case, in this MCQ. Okay, pacemaker potential is due to. Now I want you to see this MCQ, read it clearly, and you can type your answers. I'll just read out this MCQ first for the benefit of those who have joined in today. The pacemaker potential is due to a hyperpolarization induced inward current. Think about this. Increasing outward potassium current. Outward, okay, outward potassium current. Then an inward calcium current through T channels. T, and an inward calcium current through L channels. So T channels, L channels, calcium current, and a hyperpolarization induced inward current. तो अब उन्होंने पूछा है कि कौन से उसमें से करेक्ट है, विच वन इज रिस्पॉन्सिबल फॉर पेसमेकर पोटेंशियल. ए बी सी आर करेक्ट, आप देख सकते हो, ए बी सी आर करेक्ट, ए एंड सी आर करेक्ट, और बी एंड डी आर करेक्ट, या फिर ऑल फोर आर करेक्ट. तो आई गिव यू अबाउट what 15 seconds to go through this. The pacemaker potential is due to which currents given in this. Okay, a hyperpolarization induced inward current. क्या ये करंट इन्वॉल्व होता है पेसमेकर पोटेंशियल में, या फिर इनवर्ड कैल्शियम करंट थ्रू टी चैनल्स या एल चैनल्स या इंक्रीजिंग आउटवर्ड पोटेशियम करंट. ए करेक्ट है या नहीं है, बी है कि नहीं, सी और डी. और ये आपका एमसीक्यू है, कौन कौन से ऑप्शंस इसमें करेक्ट लगे आपको. Okay, no answers so far for the pacemaker potential. I hope you all can see the entire sentence. Anyways, if you are trying, good, लेकिन अब CVS स्टार्ट हो चुका है तो कॉन्सेप्चुअल है, थोड़ा थोड़ा फोकस करने की कोशिश करो. आई विल ट्राई टू स्पीक लिटिल बिट ऑफ हिंदी, लेकिन you won't miss anything because it's mainly in English and just addition, just patchwork in Hindi. Okay, so don't worry about that. What is pacemaker potential? Look, pacemaker potential. Now we are talking about SA node. Okay, pacemaker potential is shown by the SA nodal cells or any ऑटोरिदमिकली डिस्चार्जिंग सेल, और उसका एक्शन पोटेंशियल जो होता है, इट इज लाइक दिस, इट इज लाइक दिस. सो आई वांट यू टू नोट अ फ्यू थिंग्स इन दिस. वन इज, दिस इज repolarization, and at the end of every repolarization, the depolarization, next depolarization starts and reaches threshold by itself automatically. So this potential which rises to threshold at the end of every repolarization. Repolarization खत्म नहीं हुआ कि अगला depolarization threshold तक पहुंच रहा है. This is called as the pacemaker potential. Okay, this is also called as pre-potential और पेसमेकर पोटेंशियल. तो इसके आयोनिक बेसिस देख लो एक बार और बाय हार्ट कर लो. लुक, repolarization is because of the potassium exit. Okay, potassium exit. Now at the end of every repolarization, potassium exit stops and potassium which was going out now starts accumulating inside the membrane. So first part of the pacemaker potential, this part is because of the potassium current, but potassium outward current nahi, potassium just coming near the membrane. From the core of the cell, it just comes near the membrane. So that's the first one. Then second part of pacemaker potential is caused by influx of sodium through sodium funny channels. Okay, sodium funny channels. These channels are called as funny channels because it was found that more the hyperpolarization of the membrane, more they were excited, means more the current became stronger, and therefore it was also called as hyperpolarization induced. देखिए इस बात पे गौर करें कि यहां नहीं हो रहा hyperpolarization. Okay, so don't confuse here. When research workers were performing research, they found out in the case of SA nodal cell that when you make membrane hyperpolarized, this current is becoming stronger. This sodium current is becoming stronger. This they found to be funny क्योंकि सोडियम चैनल जो है और सोडियम करंट हाइपरपोलराइजेशन पर it gets inhibited. So if it gets inhibited, how come this particular channel is getting excited more? तो ये उनको funny लगा, therefore they kept the name sodium funny channel, and it's also called as hyperpolarization induced funny current. Okay, and last part of the pre-potential is because of calcium influx through calcium T channels. T stands for transient. Okay, and then above threshold the depolarization is completed by calcium L channels. Okay, तो कहने का मतलब यह है कि कैल्शियम L चैनल हालांकि डीपोलराइजेशन में इन्वॉल्व तो है, बट इट इज नॉट इन्वॉल्व इन द पेसमेकर पोटेंशियल. All right, so this is not involved in the pacemaker potential, this calcium L current. right? So the currents that are involved are these: sodium funny current and calcium current through calcium T channels. और इसलिए in the given options, what was it? Hyperpolarization induced inward current, sodium funny current, yes, that is involved, correct. And increasing outward potassium current नहीं चाहिए वो, that will not cause depolarization, okay. Inward currents चाहिए, तो B is not involved. Then C, an inward calcium current through T channels, yes, वो threshold तक पहुंचा ना, वो उसका इसके वजह से. And an inward calcium current through L channel, हालांकि this causes depolarization to be completed, but this is not involved in the pacemaker potential जो हमने देखा ना, from repolarization to the next threshold, उसमें involved नहीं है. Therefore A and C ये दो ही currents involved है, and therefore the correct answer should involve A and C, and therefore the answer is A and C, that is B. मतलब B option जिसमें A and C are correct is written, okay. So that was the we did this yesterday, and this is very similar, so we will not spend much time on this. Okay, this is the new MCQ which we have not done since yesterday. So let's have a look at the new MCQs for those students who did attend even yesterday's session. Let's start. Which structure has the maximum blood flow per 100 gram of tissue? And I am waiting again for you people. Which structure has maximum blood flow per 100 gram of tissue per minute? If you have attended my lectures of CVS, I am hoping that some of you are actually appearing for the upcoming FMGE, and you might have attended the lecture, so you will be able to answer this. Which structure has the maximum blood flow per 100 gram of tissue per minute? Brain, heart, kidney, liver? I am waiting for your answers. Come on. कोई है? Knock knock. Okay. Brain, heart, kidney, liver. Which tissue, which organ has maximum blood flow? अरे भाई ऐसे याद रखो, small tissue but massive blood supply. तो इसमें से कौन सी लगती है आपको? Small tissue but with massive blood supply. Which one is it? Yes, the answer is kidney. So just write down about the blood flow a few points. If you are a first year student, maybe you want to write a few things. Here we go. Maximum blood flow means in terms of cardiac output. Maximum fraction of the cardiac output goes into which organs or tissues? Any idea? Which organs or tissues have maximum blood flow as a fraction of the cardiac output? The best one is liver. The best one is liver. I am talking about fraction of cardiac output. 5 लीटर cardiac output है, तो उसमें से कितना हिस्सा किसके पास जा रहा है? So the perspective is cardiac output, and how much fraction is going to which part, which organ, which tissue? And the answer is the best is liver. 25 to 27% of the cardiac output goes to the liver, and second best is kidney. Okay, I am not talking about MCQ answer right now. Okay, some people have written kidney, Chinmay has written kidney, and that's a correct answer. But hold on, right now I am talking about maximum fraction of cardiac output goes to which organs. So उसमें best one is liver, and second best is kidney, that is 22 to 25%. Okay, 22 to 25%. So organ fraction of cardiac output कहाँ कितना जा रहा है, उसमें liver is the best, kidney is the second best. अब सोचो, kidney छोटा सा organ and it is receiving 25% of the cardiac output. 1/4 of the cardiac output is going to kidney. So obviously per 100 gram of tissue, अगर if we want to measure, then kidney will have a huge blood flow into the kidney per 100 gram of tissue per minute. So next one is from the perspective of the tissue or organ. आप बात को समझो. What I am trying to say is, पहला वाला अभी जो मैंने बताया, that was the perspective of the cardiac output, कि अगर 5 लीटर cardiac output है तो उसमें से कितना किस organ के पास जा रहा है. ये पर्सपेक्टिव था, तो उसमें बेस्ट इज लिवर, सेकेंड बेस्ट इज किडनी. नाउ द नेक्स्ट इज पर्सपेक्टिव ऑफ द ऑर्गन. ऑर्गन के नजरिए से देखे तो किस ऑर्गन में कितना ब्लड फ्लो जा रहा है पर 100 ग्राम ऑफ टिश्यू. तो अगर इफ दे आस्क यू द टिश्यू, ऑर्गन और टिश्यू में फर्क है. अगर इफ दे आस्क यू विच टिश्यू रिसीव्स greatest blood flow per 100 gram of tissue per minute, the answer is carotid body. Carotid body. Or agar they ask you what is the organ that receives maximum blood flow per 100 gram of its tissue per minute, then the answer is kidney. So yes, answer was given as kidney by Chinmay, and that's right answer. Kidney छोटा सा organ, लेकिन 25% ऑफ कार्डियक आउटपुट जा रहा है उसमें, तो ऑब्वियसली उसके अंदर पर 100 ग्राम ऑफ टिश्यू में मैक्सिमम ब्लड फ्लो होगा. ओके, सो दैट वाज द एमसीक्यू. बट रिमेंबर वंस अगेन, मैक्स ब्लड फ्लो पर 100 ग्राम ऑफ टिश्यू पर मिनट में कैरोटिड बॉडी का कोई मुकाबला ही नहीं है. देयर इज नो मतलब carotid body gets huge blood flow, massive blood flow per 100 gram of carotid tissue per minute. और फिर सेकेंड अगर ऑर्गन पूछा जाए तो ऑफ कोर्स किडनी. ओके, नेक्स्ट. ओके, हियर इज द क्वेश्चन एंड आई गिव यू सम टाइम टू आंसर दिस क्वेश्चन विथ अ हिंट. आई लीव इट टू यू. Following was the data obtained from a patient. Arterial BP is 90 mm of Hg and cardiac output is 5.4 liters per minute. How much is the peripheral resistance? 1 hour, 2 hour, 4 hour, 6 hour. Following was the data obtained from a patient. Arterial BP 90, cardiac output 5.4 liters per minute. How much is the peripheral resistance? Okay, 1 hour, 2 hour, 4 hour, 6 hour. Knock knock. Anybody trying to solve this question? आपके सामने MCQ है, डेटा है, you have to just put in to the equation and solve this. Cardiac output given and the blood pressure is also given 90. Cardiac output 5.4 liters per minute. How much is the peripheral resistance? Waiting for your answers. Come on guys, wake up. कोई है जो इसको सॉल्व कर सकता है? एटलीस्ट फॉर्मूला पता है? चलो सॉल्व मत करो, आई एम लुकिंग एट योर आंसर्स. तो एटलीस्ट टेल मी द फॉर्मूला दैट यू विल यूज. जस्ट टाइप, जस्ट पंच इन दोस 3 words or 3 letters actually. What is the formula that you will use to solve this MCQ from this data? Just punch in those 3 letters. Come on. Which law? Okay. तो नहीं गए हो ना मेरे साथ? चलो आ जाओ, चलो मैं लिख देता हूं. दिस इज बेस्ड ऑन दी ओहम्स लॉ. दिस MCQ इज बेस्ड ऑन द ओहम्स लॉ. ओके, हाउ वुड यू नो दैट दिस इज ओहम्स लॉ? क्योंकि आर्टीरियल BP इज गिवन, सो प्रेशर इज गिवन, कार्डियक आउटपुट इज गिवन, दैट मीन्स फ्लो इनटू द बॉडी इज गिवन, फ्लो इज Q. तो Q is given, P is given and R is asked. What is Ohm's law? Yes, R. Correct. So, Ohm's law is being used to solve this equation. और now we will try to answer this. एक बात है जो मैं आपसे शेयर करना चाह रहा था. जो स्टूडेंट्स एग्जाम दे के बाहर आते हैं उन स्टूडेंट्स ने ये बात बताई है. एंड आई डोंट वांट टू टॉम अबाउट माई सेल्फ, लेकिन 27 साल से पढ़ा रहा हूँ PG एंट्रेंस वालों को. तो ये एक चीज जो उन्होंने बताई वो ये है कि दे डिड एवरीथिंग राइट एंड येट द आंसर केम आउट टू बी रॉन्ग. ऐसा भी स्टूडेंट्स ने कहा इस बार. इवन दिस टाइम NEET PG स्टूडेंट्स सेड दिस एंड FMGE स्टूडेंट्स आल्सो कीप सेइंग दिस ऑल द टाइम. वन defect that must be happening is at the level of units. Okay, see how, why units are important. I'll prove it to you by this. Yes, somebody has answered. Chinmay has again answered. Chinmay, you are doing very well. The answer is 1 hour, and I hope you have by hearted the formula by now. So let's have a look at what I was trying to tell you just now. Units, very important. See here, cardiac output was given to be 5.4 liters per minute and arterial BP is given to be 90 mm of Hg. Okay, so how much is the peripheral resistance? That was the question. Now look, first of all, what is Ohm's law? Ohm's law is Q is equal to delta P upon R. Okay, Q is flow and blood flow to all organs is equal to cardiac output. Blood flow to all organs is equal to cardiac output. तो Q की जगह पे हम रखेंगे cardiac output. Delta P pressure, तो arterial blood pressure and R is resistance. Okay, तो ये है peripheral resistance. So this is the Ohm's law का application. This is the conversion of the Ohm's law. ठीक है, अब cardiac output is equal to blood pressure upon yes, P delta P upon R. So blood pressure upon peripheral resistance. So that means we will rearrange the equation and it will become blood pressure is equal to cardiac output into total peripheral resistance. Okay, blood pressure is equal to cardiac output into total peripheral resistance. Remember this formula forever now. Blood pressure is equal to cardiac output into total peripheral resistance. Ab they have given us cardiac output, they have given us blood pressure and they have asked the peripheral resistance in this patient. So let's rearrange the equation again. Peripheral resistance is equal to blood pressure upon cardiac output, है ना, because cardiac output यहाँ है, it will go to the other side of the equation, तो वो डिनोमिनेटर में चला जाएगा. So BP upon cardiac output is equal to peripheral resistance. ठीक है, तो अब आ गया हमारा फॉर्मूला रेडी हो गया. अब हमें सिर्फ डेटा डालने की जरूरी है और आंसर आ जाएगा. पेरिफेरल रेजिस्टेंस उन्होंने पूछा था एंड ये दो चीजें दी हुई थी, बस अभी कैलकुलेट करना बाकी है. ब्लड प्रेशर क्या था? व्हाट वाज द ब्लड प्रेशर? 90 mm of Hg. Cardiac output was how much? Cardiac output was 5.4 liters per minute. Okay, तो ओके 5.4 लीटर्स पर मिनट हमने कुछ उल्टा कर दिया क्या? ओके, पेरिफेरल रेजिस्टेंस इज इक्वल टू यस बीपी अपॉन कार्डियक आउटपुट. करेक्ट. सो 5.4 लीटर्स पर मिनट जो है, अब प्रॉब्लम क्या है इसमें? व्हेन यू डिवाइड 90 अपॉन 5.4 आंसर तो नहीं आ रहा. ऑप्शंस वेर 1 आर, 2 आर, 4 आर, 6 आर. तो लेट मी जस्ट डिफाइन द पेरिफेरल रेजिस्टेंस. डेफिनेशन सुन लो. पेरिफेरल रेजिस्टेंस इज टेकन एज PRUs, peripheral resistance units, okay, or simply called as R, and 1 R is equal to 1 mm of Hg when blood flow at the root of the aorta is 1 ml per second. बात समझे? नहीं समझे? न्यूमरेटर was mm of Hg and denominator cardiac output was 5.4 liters per minute. ये कहाँ मैच हो रहा है? लीटर्स पर मिनट को ml पर सेकेंड में कन्वर्ट करना था इस MCQ में. ओके, जो करने के बाद ही आपको आंसर आएगा. सो लेट मी जस्ट क्विकली फिनिश दिस MCQ and then move on to the next one. Peripheral resistance is equal to BP अपॉन कार्डियक आउटपुट. BP कितना दिया है? 90 mm of Hg एंड कार्डियक आउटपुट 5.4 लीटर्स पर मिनट. 5.4 लीटर्स पर मिनट को आप कन्वर्ट करो ml पर सेकेंड में. 5400 अपॉन 60 सेकेंड्स, ये है 90 ml per second. So 5.4 liters per minute is same as 90 ml per second. 90 ml per second. So 90 upon 90, the answer was 1 hour in this particular MCQ. Okay. जिन्होंने भी 90 upon 5.4 करने की कोशिश की, that was not right. Because 5.4 was liters per minute. You have to convert this into ml per second. Only then the units are matching. Okay. So my sincere suggestion to you all is always look at the MCQs. And मैं अभी कुछ खट्टा कहने जा रहा हूं, तो उसको भी सुन लेना. Look, MCQs जो बनाते हैं ना, वो कई बार लेजीनेस भी दिखा सकते हैं. Like they can take the same MCQ which was asked previously and just उसके units change कर देंगे, ml per second, liter per minute, and they might put the numbers also, some change numbers. और इसलिए always whenever you see the MCQ, first look at carefully the units. ऐसे MCQ कभी देखे ना, always look at the units carefully कि क्या वो सब units सही है, एक जैसे है, can they be put into some equation, and then you can move ahead and solve the MCQ, तब वो correct आएगा. तो ये मेरा experience, अनुभवाचे बोल या experience के जो words है, उसे याद रखना. Okay, let's go on to the next MCQ. अच्छा, okay. I hope you can see the entire board now. A 70-year-old woman had an ECG at her annual checkup. So, those who are watching can write down the formula to calculate heart rate from ECG. Can you write the heart rate? Can you write the formula for heart rate from ECG? I am looking at the chat box right now. Lead to recording है, बाकी सब छोड़ो. Calculate the heart rate from the ECG. Just giving you 5 seconds. So it was just a 5 seconds silence for you to recall the formula. Those who are watching can recall the formula. Yes, Yudhishthir Latwal. Yes, you are right. 1500 divided by number of small squares. Yes, the formula has come already. Good, Yudhishthir, keep it up. अब ये 1500 कहाँ से आया उतना बता देता हूं और फिर आगे चलते हैं. सबसे पहली बात है कि ECG का पेपर, स्पीड ऑफ द पेपर इज 25 millimeters per second. I hope you have seen the ECG recording. एक ग्राफ पेपर होता है, it moves. What is the speed of that ECG paper? 25 millimeters per second. अगर वो 25 millimeter जाता है एक सेकेंड में, तो एक मिनट में कितना जाएगा? 25 into 60, that is 1500 millimeters. So ECG paper पे 1500 millimeters constitute 1 minute. Okay, that is where this 1500 has come from. Yes, correct. Even Amit Mishra also has answered now. 1500 कहाँ से आया? ये है वो 1500. Okay, 25 into 60. On graph paper, ECG paper, 1500 constitutes 1 minute. ये समझ में आ गया तो बात एकदम सिंपल है. Now see, we want to look here and say what constitutes one heartbeat. Distance between two R waves constitutes one heartbeat. Okay, distance between two successive R waves constitutes one heartbeat. तो अभी आप सॉल्व कर सकते हो. R और R इंटरवल, इसके बीच में कितने मिलीमीटर्स है वो गिनना बाकी है. सो 5, 510, 515, यहाँ के 3 और यहाँ के 3, तो 15 plus 6, 21. So I would say now RR interval is 21 millimeters. Okay, that means one heartbeat is constituted by 21 millimeters. देखो RR interval क्यों लिया? Those who are first year students and those may be listening for the first time. we want to have a definitive point on the ECG, and that definitive point generally is the R wave, very definitive point. So PQRST forms one heartbeat, और R और R के बीच का डिस्टेंस कॉन्स्टिट्यूट्स वन हार्टबीट, ऐसे भी कह सकते हो. अब इसमें है 21 स्मॉल स्क्वायर्स, 21 मिलीमीटर्स कॉन्स्टिट्यूट वन हार्टबीट. ये 21 मिलीमीटर्स है. इफ दे कॉन्स्टिट्यूट वन हार्टबीट, देन in 1500 millimeters, how many such beats occur? 1500 divided by 21, that will be number of beats per minute, and that is heart rate, number of beats per minute. So 1500 divided by x, x is distance between two successive R waves. ये उसका फॉर्मूला था. So हमारे लिए इंपॉर्टेंट ये है कि भाई एटलीस्ट हम ईसीजी कैसे सॉल्व करना है वो देख ले. चलिए अगला एमसीक्यू है. वो तो आप ऐसे खड़े खड़े आंसर दे सकते हो, खड़े खड़े या बैठे बैठे जिस भी पोजीशन में हो, इसका आंसर आप ऐसे ही टाइप कर सकते हो. फटाफट टाइप करो. व्हेन रिकॉर्डिंग लीड 1 ऑन एन ईसीजी, द राइट आर्म इज नेगेटिव इलेक्ट्रोड एंड द पॉजिटिव इलेक्ट्रोड इज विच वन ऑफ द फॉलोइंग. लीड 1 का निगेटिव यहां है, तो पॉजिटिव कहां है ये पूछा गया है. तो मैं रुक रहा हूं आपके आंसर्स के लिए. बता दो कि लीड 1 का निगेटिव अगर राइट आर्म है तो पॉजिटिव कहां है. आई एम वेटिंग फॉर योर आंसर्स. पॉजिटिव इलेक्ट्रोड इज विच वन ऑफ द फॉलोइंग. लेफ्ट आर्म, लेफ्ट लेग, राइट आर्म प्लस लेफ्ट लेग. ये तो ऑप्शन 4 इज तो बहुत ही गया गुजरा है. यस, करेक्ट. ए युधिष्ठिर अगेन, करेक्ट. युधिष्ठिर, यू आर डूइंग वेल. You are not only fast in answering, but you are answering correctly also. Good, buck up. Okay, so lead 1, just for the sake of revision. Oh, let's have a revision of those leads. Okay, just quickly, 15 seconds. Lead 1, negative on the right arm, positive on the left arm. Lead 1. Lead 3, negative on the left arm, positive on the left leg. And lead 2, let's have a different color to avoid mix up. This is lead 2, negative on the right arm, positive on the left leg. Okay, so right arm is always negative for all the leads, and left leg is always positive for all the leads. Okay, these are the bipolar limb leads of Einthoven. All right, next. Okay, a person's ECG has no P wave but has normal QRS complex and a normal T wave. Therefore, his pacemaker is located where? Now I leave it to you. Come on. A person's electrocardiogram has no P wave but has a normal QRS complex and a normal T wave. P wave है ही नहीं, but QRS complex है और T wave भी है. Therefore, his pacemaker is located where? SA node, AV node, bundle of his Purkinje system. QRS complex is absolutely normal, okay, but P wave is absent. So where would you say is his pacemaker located? Come on, SA node, AV node, bundle of his Purkinje fiber. Okay, Amit Mishra says B, but Yudhishthir says D. Anybody else? Knock knock. Anybody attending? Trying to answer? I just want to make you little, think कि क्या हो सकता है, and then we will check. Normal QRS complex, इसका मतलब Q wave normal है. Q wave means interventricular septum. Okay, तो Q wave is जब bundle branches में depolarization होता है, septal depolarization. So that is Q wave. QRS complex normal है, but P wave is absent. That means atria में उसका ये नहीं है, pacemaker नहीं है. So SA node and AV node both are gone. But what about bundle of his? If bundle of his is the pacemaker, then you can have a clean QRS complex because Q wave तो उसके नीचे से ही शुरू होती है. Septal depolarization वो bundle के नीचे होता है. और फिर anti wave is also normal, so ventricular repolarization is also normal. This is located in the bundle of His actually. Let's move on. Next, S2 is okay. चलो आगे बढ़ते हैं. Actually we have lots of ground to cover. अगला MCQ है, S2 is produced in part by hemodynamic events in immediately following the closure of aortic and pulmonary valves. पहले 2-3 सेंटेंसेस ऐसे ही वो आपको कंफ्यूज करने के लिए दिए है. एक्चुअली आंसर कहीं और है. एक्चुअली क्वेश्चन लास्ट लाइन में है. S2 occurs during which phase of the cardiac cycle? Is it protodiastole, isovolumic relaxation, first rapid filling or diastasis? तो चलिए, just recall your cardiac cycle events. I am waiting for you. Come on. Yudhishthir is very, very quick, and not only very quick but is also right. लेकिन मैं स्टिल वेट करूंगा. और भी कोई लोग हैं आंसर करना चाहे कर सकते हैं. सेकेंड हार्ट साउंड इज प्रोड्यूस्ड इन पार्ट in which phase of the cardiac cycle? Okay. Anybody still? Amit Mishra A. Yes. तो अभी ये दो लोग जंग कर रहे हैं करेक्ट आंसर और रैंक के लिए. अमित मिश्रा, युधिष्ठिर. तो आई वुड से कम ऑन, बोरसे, प्रशांत, बकअप, यू आर ऑल्सो देयर. और बाकी भी मेडिको फॉरएवर, चिन्मय, just try answering. I'm sure you are answering in your notepads, but still. Okay, the answer is protodiastole. Look, now we can't have entire cardiac cycle. We have less time. But the point is that at the beginning of ventricular diastole, ventricular pressure begins to fall. And as the ventricular pressure begins to fall, the blood that was ejected during systole starts regurgitating back, starts coming back toward the ventricle. Okay. एओर्टा और पल्मोनरी आर्टरी में जो ब्लड पंप आउट हुआ था वो वापस आना शुरू होता है क्योंकि वेंट्रिकल इज गोइंग इनटू डायस्टोल. बट एओर्टिक एंड पल्मोनरी वाल्व्स किस लिए है? व्हाट आर दे मेंट फॉर? दोज वाल्व्स आर मेंट टू प्रिवेंट दिस बैकफ्लो ऑफ ब्लड एंड देयरफॉर व्हाट हैपेंस इज एओर्टिक एंड पल्मोनरी वाल्व्स विल क्लोज. तो ये जो बैकफ्लो ऑफ ब्लड था ना, फॉर मोमेंटरी बैकफ्लो ऑफ ब्लड, दैट इज कॉल्ड एज प्रोटोडायस्टोल. आज ही याद रखना इसको, आज के बाद हमेशा याद रखना. प्रोटोडायस्टोल. प्रोटो का मतलब क्या होता है? आप अगर सुन रहे हो आप लोग तो जस्ट लिख सकते हो, कुछ तो लिख सकते हो यहाँ पे. प्रोटोडायस्टोल में प्रोटो का मतलब क्या होता है? प्रोटोडायस्टोल छोड़ो, प्रोटॉन का मतलब बताओ. ठीक है, प्रोटॉन का मतलब होता है प्रोटोस, मतलब वन. तो आज के बाद हमेशा याद रखना, फर्स्ट फेज ऑफ द डायस्टोल, दैट इज प्रोटोडायस्टोल, फर्स्ट फेज ऑफ द डायस्टोल. ओके. अरे भाई आपको पता है ना, प्रोटैनोपिया मतलब क्या? नंबर 1 कलर का ब्लाइंडनेस, रेड कलर का ब्लाइंडनेस. तो प्रोटॉन मतलब बॉडी में एक. तो प्रोटोडायस्टोल मतलब फर्स्ट फेज ऑफ द डायस्टोल. कौन सी थी? ये रिगर्जिटेशन ऑफ ब्लड, मतलब बैक फ्लो ऑफ ब्लड. लेकिन उसके बाद aortic and pulmonary valves close and that produces the second heart sound, and therefore technically speaking second heart sounds occurs at the end of the protodiastole and therefore it occurs in the protodiastole. ये एक स्ट्रेट फॉरवर्ड क्वेश्चन था. आपको आज की तारीख में बता दूं, जस्ट मार्क माय वर्ड्स, जो भी अपकमिंग FMGE एग्जाम है या कोई नीट पीजी के लिए भी बैठा हो, एनी एग्जाम यू आर अपीयरिंग फॉर, one question from the cardiac cycle is going to be there. Bet. One question from cardiac cycle. It can be JVP, it can be anything. There are high yield topics and yeah, by the way, I am asked to remind you all that all these questions and their answers, notes will be available in the PW app. Okay. So all this will be uploaded in the app. The notes are going to be uploaded in the app. Explanatory answers also. Yeah, so the point I was making was this, there are high yield topics that FMGE students have to prepare as a last minute preparation. So uska, that list also I will put up on the channel. Which topics you should never forget? One of them is the cardiac cycle. All FMGE students listening, okay. Now this is about the JVP. Next question, why descent in the JVP is due to? I'm waiting for your answers. I'm looking in the chat box. Why descent in the JVP is due to? Come on, anybody home? Anybody listening? Anybody answering? ओचा एक और रह गया ना इधर, कट हो गया. Okay. Why descent in the JVP is due to atrial diastole, closure of tricuspid valve, opening of tricuspid valve, or isovolumic relaxation of the right ventricle. Why descent in the JVP is due to what? Opening of the tricuspid valve and followed by, yes, filling of the ventricle. Chinmay is right this time. Chinmay, good. You have come up with the correct answer. तो आपके रिवीजन के लिए एक बार 2 मिनट्स में जेवीपी बता देता हूं, बाय हार्ट कर लेना, याद कर लेना. लुक, एट्रियल इवेंट्स आर रिकॉर्डेड फ्रॉम द इंटरनल जुगुलर वेन, और जिसको कहते हैं जेवीपी. ओके, एट्रियल इवेंट्स को रिकॉर्ड करने वाला जो है वो जेवीपी. अब एट्रिया में तो 2 इवेंट्स है. देयर आर ओनली 2 इवेंट्स इन द एट्रियम, राइट एट्रियम में और लेफ्ट, 2 इवेंट्स, एट्रियल सिस्टोल और एट्रियल डायस्टोल. एट्रियल सिस्टोल, राइज ऑफ प्रेशर, atrial diastole, fall of pressure. So this should have been the shape of the JVP, but no, during atrial diastole, 2 events in the ventricle, they cause rise of pressure again, and therefore we get the JVP in this shape. Rise of pressure, then again rise of pressure, then again rise of pressure. That's your JVP. Okay, so just revise. A, C, V, X down slope, Y down slope. So A stands for atrial systole, C stands for isovolumic contraction of the right ventricle, V stands for venous blood accumulated during isovolumic relaxation. Okay, repeat this in your mind. A stands for atrial systole, A. C stands for isovolumic contraction of the right ventricle. V stands for venous blood accumulated in the right atrium because of isovolumic relaxation. या फिर simply atrial systole, isovolumic contraction of ventricle, isovolumic relaxation of the ventricle. X stands for ventricular ejection and Y stands for ventricular filling. So tricuspid valve opens and this down slope happens, ventricular filling, और atrium का pressure fall हो जाता है, that is Y down slope. All right, so that's how you can simply remember atrial systole, isovolumic contraction, isovolumic relaxation, ACV. Okay, question number 19. Come on, let's spruce up and try to answer the remaining MCQs. Incisura of the arterial pulse corresponds to which of the following events? Incisura in the arterial pulse. Before this it was jugular venous pulse, now it's arterial pulse. So first heart sound or closure of the aortic valve or isovolumic relaxation, or third heart sound. Incisura is caused by what in the arterial pulse? Anybody? Incisura in the arterial pulse. Chinmay again. Yes, closure of the aortic valve leads to that notch in the arterial pulse called as incisura. बाकी ये सब सेम है, cardiac cycle related questions है. So let's go and look at them one by one. Which phase of the cardiac cycle follows immediately after the beginning of QRS wave? QRS wave के बाद which phase will immediately occur? Okay. QRS wave means what? Ventricular depolarization. तो उसके बाद immediately which phase of the cardiac cycle will occur? And the options are isovolumic relaxation, atrial systole, diastasis या isovolumic contraction. This though you should be able to solve. Come on, I want a deluge of answers now. Come on, flood with answers. QRS complex के बाद immediately what will follow in the cardiac cycle? Yudhishthir is saying D. Do you all agree? Yudhishthir, you are really very fast and correct. That's a very good thing. Okay. Yes, Amit also is saying D, and yes, it is D. Look, depolarization of the ventricles is marked as QRS complex on the ECG. So, depolarization के बाद क्या होगा? Ventricles will contract. तो भाई ventricular contraction की तो एक ही फेज दिया है 4 में से. that is isovolumic contraction of the ventricle. Okay, so that was the answer. Again, cardiac cycle. So now these are the questions which are asked from the cardiac cycle. I wanted to just give you a feel of what kind of MCQs are asked. So mostly they are related to the cardiac cycle. Okay, this is a tricky one. So I want all of you, Yudhishthir, Bhavna Sharma, Amit Mishra, Chinmay, all of you all are answering excellent. Borse Prashant also I can see, Medico Forever, Dr. Shrestha Singh, all of you have answered. तो मैं अब आपको चैलेंज करता हूं इस MCQ के लिए. I will give you 10 seconds, 15 seconds to answer this question. A 25-year-old athlete has an ejection fraction of 0.50. Ejection fraction of 0.50 and an end systolic volume of 50 ml. What is his end diastolic volume? Okay, MCQ दिया हुआ है आपको and ये डेटा है. I mean these are the options: 75 ml, 100 ml, 125 ml, 150 ml. So what's your opinion? Anybody? चिन्मय, ये आपका डी जो है वो पहले का ही कि अभी इस MCQ का है? 75 ml, 100 ml, 125 ml, 150 ml. Oh, Chinmay has now said B, 100 ml. I want to just read it out once again. Give a thought and answer the question. Okay. Ejection fraction is 0.50. End systolic volume is 50. What will be the end diastolic volume? And Chinmay has written one answer, that is B. I wouldn't say right or wrong because I am assuming that others are also trying to calculate and think about this MCQ. So right or wrong नहीं कहूँगा अभी. Come on, come on, come on. End systolic volume दिया हुआ है, end diastolic volume पूछा है, और ejection fraction बहुत simple figure है, very simple, 0.50. चलो hint देता हूँ, युधिष्ठिर hint देता हूँ. 50% ejection fraction 0.50 is creating confusion. Look at it as 50%. Now you can answer the question. Yes, Chinmay has given it correctly, formula also. Amit Mishra also has given correct answer. Yes, correct answer B. And yes. Oh, now everybody is answering correctly. So, ये देखो, ejection fraction is 50%. Okay, that was the key. So those who have not understood what the use of data was, देखो, what is ejection fraction is equal to stroke volume upon end diastolic volume into 100. Okay, that is the ejection fraction. Ventricles eject this much fraction of blood in every systole. लेकिन from what blood? From the end diastolic volume. Means, सुनो, this much blood fills in the ventricle by the end of the diastole. फिर उसमें से अगले सिस्टोल में इतना ejected out, इतना % ejected out. That is called as ejection fraction. Okay. Now they have given us ejection fraction as 0.5 दिया था, मतलब 50%. इसका मतलब ही साफ था कि एंड डायस्टोलिक वॉल्यूम जितना भी होता है बाय द एंड ऑफ द प्रीवियस कार्डियक साइकिल, उसमें से 50% इजेक्ट आउट होता है. और याद रखो, अगर 50% इजेक्ट आउट होता है सिस्टोल में, तो बाय द एंड ऑफ द सिस्टोल जो बचेगा वो होगा एंड सिस्टोलिक वॉल्यूम. ओके, दे हैड गिवन एंड सिस्टोलिक वॉल्यूम एज 50 ml. तो देखो ना, 50 ml was end systolic volume. तो सिस्टोल में स्ट्रोक वॉल्यूम कितना रहा होगा? 50 ml. 50 ml इजेक्टेड आउट और बचा 50 ml, और एंड डायस्टोलिक वॉल्यूम मस्ट हैव बीन 100 ml. तो 100 ml एंड डायस्टोलिक वॉल्यूम, उसमें से 50% मतलब 50 ml was इजेक्टेड आउट, और बचा एंड सिस्टोलिक वॉल्यूम वो बचा हुआ 50 इजेक्ट आउट हो गया, और जो बचा वो होता है एंड सिस्टोलिक वॉल्यूम. which is the 50 ml. तो उन्होंने end systolic volume पहले से देके रखा था. Then you have to calculate how much was the end diastolic volume. Yes, 50% eject out हुआ, 50% बचा, तो 50-50, and that's 100 ml was the end diastolic volume. Okay, so this was just to trick you कि भाई डेटा उल्टा पुल्टा करके दो, ऐसे दो वैसे दो. आपको बस समझना है कि सबसे की डेटा क्या है उसमें. इजेक्शन फ्रैक्शन 0.50 और 50%, दैट वाज द डेटा. ओके, व्हेन अ पर्सन, अच्छा ये दिस मच यू कैन सॉल्व बाय योरसेल्फ, सो easily actually. When a person moves from supine position to a standing position, which of the following compensatory changes will occur? From supine, the person goes into standing posture. Which of the following will occur? देखो, decreased heart rate, increased contractility, decreased total peripheral resistance, or decreased cardiac output. Anybody? Okay, Chinmay, Amit Mishra, Yudhishthir, Borse, where are you all? Are you all listening? Supine to standing position जाने पर which of the following will occur? Whether it is decreased heart rate or increased contractility of the heart, or decreased total peripheral resistance, or decreased cardiac output. क्या होगा? और बाकी तीन नहीं होंगे. Waiting for your answers. C. Okay, Yudhishthira said D. Cardiac output decreases because from supine to standing position there is a decreased cardiac output. Yudhishthir, you are not only fast but you are also right. Okay, so very good. Come on, all the others also have to compete. Okay, spirit of competition. MCQs करेक्ट आने चाहिए, रैंक भी ऊपर आना चाहिए. ओके, ऐसा जज्बा रखना है. सो लुक, व्हेन द पर्सन गोज फ्रॉम सुपाइन टू स्टैंडिंग पोजीशन, आपको भी कभी फील हुआ होगा व्हेन यू गो टू, रात भर सोए और सुबह सुपाइन से स्टैंडिंग में गए, एक सेकंड के लिए हल्का सा चक्कर जैसा लगता है, हाँ, एंड देन यू आर ऑल राइट. व्हाई इज दैट? दैट इज बिकॉज व्हेन यू स्टैंड अप लाइक दिस, blood is pooled in the lower extremity vessels, which means what? Which means venous return to the heart will decrease temporarily. Which means what? Venous return क्या determine करता है? Cardiac output. तो cardiac output will also decrease momentarily. Cerebral blood flow थोड़ा सा कम होता है और हमें वो चक्कर जैसा feel होता है, dizziness. Okay. So therefore, in this case, heart rate increases, you know, because immediately what happens is there is baroreflex mechanism which is activated and heart rate increases. So यहाँ पे decrease heart rate दिया है, वो correct नहीं है. Contractility will decrease क्योंकि venous return कम जा रहा है ना heart में, तो heart will contract less vigorously. So decreased contractility होगा and answer was decreased cardiac output. Okay, चलिए एक आखिरी MCQ ले लेते हैं. All the other MCQs I am going to put up on the, we are going to put up all these MCQs in the in our app. The PW app will have all these MCQs with answers and explanations. So एक last one MCQ and then we will stop the session over there. This basically this session was kept to just give you the feel कि कैसे MCQs आ चुके हैं या आ सकते हैं. Okay. And I hope that we meet more often live or recorded, and we will have more interactions between amongst ourselves. So PFT performed on a patient showed following results depicted in the graph. This is the graph given to you. I hope you all can see the graph. And now this is volume and this is pressure. So volume and pressure is shown to you. बाय द वे, कोई है जो ये बता सकता है कौन सा ग्राफ है? आई एम लुकिंग एट योर आंसर्स, मतलब ये यहाँ का आंसर, ये कौन सा ग्राफ है? यहाँ पे प्रेशर है, यहाँ पे वॉल्यूम है. 600 ml वॉल्यूम एंड प्रेशर cm ऑफ वाटर. तो हाउ मच इज इट? आई मीन व्हाट ग्राफ इज इट? एनीबडी? युधिष्ठिर, अमित, चिन्मय, कम ऑन. यस, कॉम्प्लायंस, करेक्ट, कॉम्प्लायंस का ग्राफ है. करेक्ट compliance का ग्राफ है, pressure on the horizontal axis and volume on the vertical axis. So what graph is this? ये पूछा गया है, नहीं सॉरी ये पूछा नहीं गया. What they are asking is, हाँ अच्छा क्वेश्चन तो नीचे ही है, हाउ मच इज द कॉम्प्लायंस इन दिस पेशेंट. अरे वो निकालना है आपको. चलो पेन और पेपर ले लो, कैलकुलेट करो और मुझे बताओ. कैलकुलेट कॉम्प्लायंस फ्रॉम दिस ग्राफ गिवन टू यू. आई एम वेटिंग, आई एम लुकिंग टू ऑल द स्टूडेंट्स हु आर वाचिंग. अमित, युधिष्ठिर, चिन्मय, भावना एंड बोरसे. प्रेशर इज गिवन, volume is given. Calculate the compliance. Are you calculating? Okay, अरे एक हेलो आ गया. हेलो शैशव, प्लीज कैलकुलेट. आपको ग्राफ दिया है. This is just for calculation. Pressure is given, volume is given, compliance is a pressure volume relationship. So I am waiting for your calculation. Acha, I'll give you a hint. Hint is intrapleural pressure is going from -5 to -8. मतलब कितना फर्क हुआ? 3 centimeters of water का. Okay. और volume is shown to be 600 ml. देखो ना, -5 से -8 तक गया इंस्पिरेशन. -5 से -8 inspiration completed here at this point. And how much was the volume distension? 600 ml. तो 3 सेंटीमीटर ऑफ वाटर के प्रेशर चेंज के लिए 600 ml का डिस्टेंशन हुआ है. तो 1 सेंटीमीटर ऑफ प्रेशर से चेंज से कितने का डिस्टेंशन होगा? See the options and tell me the answers. Is it 100 ml per cm of water, 150 or 200 or 300? 600 ml डिस्टेंशन के लिए 3 सेंटीमीटर का प्रेशर चेंज हुआ है. तो पर सेंटीमीटर ऑफ वाटर कितने का चेंज होगा वॉल्यूम डिस्टेंशन? 600 ml डिस्टेंशन in 3 centimeters of water pressure changed. 600 divided by 3. Yes, अभी आ गया आंसर बराबर. युधिष्ठिर is always first to answer. C, yes, शैशव, yes, शैशव ने 3 बार आंसर लिखा, एक बार C, एक बार 200, एक बार फिर से 200, बट कोई बात नहीं. Correct, that shows the enthusiasm. And I think that's all for today's session. It was expected to be a 1.5 hours session or thereabouts. So we are completing this one major system, that is CVS, and also one general physio जो कल भी लिया था. In the upcoming sessions, if I am given one more session, which I will request because yesterday's session was not so much fruitful, so we will try to cover more ground and we will try to have more MCQs in more systems, means more systems can be covered in the MCQs. So I think that's all for today. I will ask the backup team to just take a break at this point, and that's all. Thank you very much for attending the session. One or two announcements, and that is notes are going to be given in the PW app. So please have a look at the notes, and these MCQs, their answers, explanations are also going to be given in the PW app. So that's all for today, and we will meet more often in the coming days. Yeah, thank you. Thank you, Yudhishthir.